Have you had a DEXA scan and looked at the results and thought to yourself, I have no idea what this means? Today, we're going to talk about the DEXA, what your score means, and help you understand what is tested. I'm Sarah. Welcome to my YouTube channel. I am so glad that you are here with me on the journey to better bone health. Let's dive into the DEXA. Today, we're going to talk about what a DEXA score means and to help you understand what's tested when you have a DEXA scan done. So let's begin with what the ranges mean. If you have a score of a -1 or above, then you have what's considered normal bone density. If your score comes between a -1 and a -2.5, then you have what's called osteopenia. This means that you have bone loss, but it's not severe enough to be considered osteoporosis yet. When your score is below a -2.5, then that means that you have osteoporosis. This is the range where it becomes necessary to make life changes to help protect yourself from fractures. If you'd like to learn more about how to protect yourself from fractures, join the waitlist for my program, the Bone Builder System, which will be starting this coming January. There will be a link down below, and I hope you'll join me. Aside from what your score means, let's go over what parts of the body are tested during a DEXA. So generally, a DEXA tests a point at your spine and at your hip. If a doctor has a reason to check something different, then they will. That can certainly happen. Generally, the places that are tested are the spine and the hip. A common place of confusion is when someone gets their DEXA back and it says that they have osteoporosis in their femoral neck. This can cause immediate concern over a possible fracture in the neck. But you don't need to worry about your neck in this instance. The femoral neck actually refers to the top of your femur bone, which is the big bone in your thigh where it connects to your hip. This is a common fracture point. Spinal compression or wedge fractures are the most common osteoporotic fracture, and the second most common fracture point is the hips or the femur bone. This refers to the femoral neck. So if your DEXA refers to the femoral neck, it's referring to the place where your thigh bone connects to your hip bone. The DEXA is considered highly accurate with a 1 to 2% error margin, which is quite good compared to other medical technology. But what a DEXA cannot measure is bone quality. Say a person has osteoporosis and they choose to take a medication that their doctor recommends that reduces the amount of bone that's broken down. On the surface, this sounds like a great plan, right? Stop the bone from breaking down and then there's more bone. But what really happens is much more nuanced. Yes, there are medications that stop bone from being broken down, but what does that really mean? So our bones are made up of cells, just like the rest of our bodies, and over time, the cells of our bodies need to be replaced with newer and healthier cells. Our bones have a natural process for this. It's called bone remodeling. We have cells that create more bone and cells that get rid of the old bone. We have bone loss when we have more bone that's being swept away than is being added. So peak bone mass is reached at about age 30, and after that, the body starts to make less and less bone. Let's go back to our problem though. So the medication can stop the old bone from being swept away, but that doesn't mean that the bone is really fracture resistant because it has all the old bone cells that the body would normally sweep away. So sometimes someone who's been taking a medication to stop the bone from being swept away will have what's considered a spontaneous fracture. This is because the bone has sheets of old dead cells that are not high quality bone cells. So then the question is, what can you do to improve bone quality? So first, find out where your bone loss is. Is it in your hips or in your spine? Is it both places? And then find someone to work with who is trained to work with bone loss. Target the areas where the bone loss is happening with strategic exercises that will strengthen and improve bone quality. And at the same time, eat a diet that's rich in vitamins and minerals and that will support having healthy bones. So I want to make clear that I'm not making a recommendation that you should not take medication. It's a really personal decision and one that needs to be made between you and your doctor. What I am saying is that bone quality can and should be improved whether you choose to take medication or not. We can do something to improve our bone health, and I think that it's worth the effort to do so. If you would like to work with me to improve your bone health, please reach out and let's talk soon.